what does this tell us? So per the current supply, Ghana's health workforce production is operating at 71% of its capacity. If we maintain this, it will result in a 43% increase in the health workforce, which will grow from 294,000 to 420 by 2030. But if we maximize our health workforce, that means we are increasing it from 71% to 100%. Then we are going to produce a lot more, a little over 500. If we utilize the maximum capacity alongside a 20% reduction in attrition, and attrition rate is now about 3%, and a 10% scale up in the capacity, we will increase the health workforce supply by 81%, culminating in a workforce of 533,000 by 2030. The need-based requirements, as projected from 2022, was 367,000 across 69 occupations, which we are comparing to our current supply of 29,000. So you realize that with this dynamics, if you actually do the maths, you realize that we seem to have at least about 80% of the health workforce required. That's as if we're employing all of them. We will have them to cover at least 98% of the disease burden. By 2030, the overall shortfall would have been 729 if we're just going by the normal capacity and all that. And if we are even able to maintain our current supply rate, just suppose that with the projected need, the deficit would have been 72,000. But the good news is that we still would have been covering about 93.7% of the disease burden. As for the fiscal space, it keeps on increasing. Basically, we need to invest more. If we can find the fiscal space, we should find it and employ more people into the service, because we are actually not meeting the needs of the Ghanaian. If you do the analysis, you realize that, look at the blue and purple lines. Those ones are the cumulative financial space for the purple one is for public sector, the blue one is for the private sector. When you add both, you are somewhere around the dotted red line. But if you see the green, that is where our focus should probably be. So you can actually clearly see the gap. So the discussion probably should be, how do we move? How do we actually fill this gap, this investment gap? Let's cost it, and let's look at where we can make savings when it comes to efficiency gains within the sector, and see how we can actually bridge this gap. Now, one of the sections of the HLMA was actually an exploratory survey of more than 2,700 respondents. And our focus then, as you can glean from the policy question, was to look at migration. So, even with an attrition rate of 3%, it was quite clear that this had actually increased from 2021, between 2021 and 2023. It was difficult to get data on the actual numbers which have left the country or Japan. This was because, where do we take the data from? NMC, maybe those who are taking letters of goodwill, we could do that. What is the Ministry of Interior saying? Do the Ministry of Health have those records? Is there a repository of data that we can actually latch on and know how many have actually left? Because as of 2022, if you look at the salary roll, it says that, oh, we are just missing about 1,500. 1,500? When Punchline was complaining that all their nurses were leaving, and every day you have a call from a nurse saying that I'm writing one exam or the other. But we couldn't actually get much data, confirmed data of exactly how many have actually left the shores for greener pastures. But if we can use this as a proxy, The number of nurses seeking verification of good standing to migrate increased from 2,600 in 2020 to 6,000 in 2022. You've calculated more, eh? But I'm sure UK was happy to receive us because they did report that about 3,000 professional nurses and midwives emigrated in the first quarter of 2022, showing a 1,300% increment in the number of Ghanaian nurses which are registered in UK between 2019 and 2022. And if you look at the records, in 2022, more than 700 nurses have also passed the NCLEX in USA. I'm sure by now they've left already.